Good afternoon, everyone, and welcome to our Healthcare IT Services Quarterly Benchmark Performance Review webcast highlighting the results from our recent Healthcare IT Services benchmark. My name is Allison Crawford, and I'll be your host for today's session. In the next 45 minutes, Analyst Joe Walent will walk you through the trends driving the results featured in the benchmark and how vendors have responded, followed by Q&A and how these results may affect your business. But before I pass this over to Joe, there are a few logistics I'd like to cover. First, we're recording today's session and posting it on our YouTube site, TBRI channel. We encourage you to visit this channel to watch this presentation or any of the others that we've posted. Second, we'd like to hear your opinions and thoughts on the materials we're presenting. Please send any questions or comments to the Q&A or chat function. Joe will address them at the end of the presentation. Or if you'd like to set up a client inquiry for more detailed discussion, please reach out directly to Joe to set up that discussion. Third, we'll send out the slides to everyone registered for today's webcast within 24 hours of the conclusion of the webinar. You can also find the slides as well as other thought leadership pieces, webinar decks, and commentaries on SlideShare at www.slideshare.net/TBR_market_insight. And I'll be providing you with social media links at the end of the webcast, so if you did not catch that, don't worry, I'll give it to you at the end. With that, let me introduce Joe Walent, who is the lead of our Healthcare IT Services program. Since its launch, Joe has expanded the program to cover 19 companies on a quarterly basis. His insight into the performance of the HITS vendors is unparalleled in the industry, and his guidance has assisted countless clients with their strategic planning. And with that, let me hand this over to Joe.
Thank you, Allison, and hello to everybody. Thank you to those of you that are joining again. Just a brief overview for those of you that aren't familiar with TBR HITS practice. As Allison said, we cover 19 companies. 18 are tracked on an ongoing basis for metrics, and then we have another company that's a little doesn't report as much that's included. Based on that, we also cover 5 of them directly, and that gives us additional insight into the specific health IT service operations of those companies. And with that, I'd like to begin and talk about the main trends that we saw in the fourth quarter. So the top 3 were interoperability, mobility, and regulatory. And these 3 things were also significant in their discussion in the most recent Health Information Management Systems Society meeting held after the end of the fourth quarter. So let's hone in on interoperability. Basically what we're seeing here is that there's an overwhelming drive, and in the fourth quarter it really gained traction, was for the standardization of information protocols and how companies are registering information, healthcare providers, healthcare payers, pharma companies, and being able to translate that information across systems. And we're seeing more and more demand coming to the health IT service operators. They're reporting seeing more of this, and there's also a lot more opportunity that's coming to bear. That, and also the formulation of strategies to get into the sheer volume and just of unstructured data that is associated with health IT. And with patient records, electronic health records coming and having that unstructured data be accessible and usable. And one of the things that we're seeing is those companies that have a strong background in financial data transfer and mapping those fields to fields are very adept with the structured data, but those companies that are coming up with new ideas as far as how to leverage unstructured data are gaining traction in the space. So one of the big things that came out of the interoperability and gaining that traction that we're seeing was the formation of the Commonwealth Health Alliance. And this was announced at the HIMSS conference at the beginning of March. You had McKesson, Cerner, Allscripts, Relay Health, and Greenway, as well as Athena Health coming together and basically laying out their strategy as far as how they're going to put together that interoperability, those standardized data fields that will be needed to translate that information and help drive to that accountable care organization or that coordinated care that is becoming the centerpiece of the Affordable Care Act, as well as the delivery of healthcare on a global scale. One of the key components of the Commonwealth Alliance is that it is working very closely with the government as far as determining what information would be of greatest value, how they can use this information for population health and demographics. And along those lines, it's definitely going to become an industry standard. Now, there was a lot of debate around this. One of the largest and more significant players, Epic, wasn't a part of this Commonwealth Alliance, and there was definitely some going back and forth between members of the alliance and Epic as far as what this truly means for the marketplace and how it's being leveraged, whether it's a marketing piece or if it's really going to become that self-determined industry standard that companies are going to be driving to. So one of the things that is on top of this, though, is TBR recognizes that your general IT service providers that are adept at having that systems integration experience are going to be able to move into this area and definitely generate additional traction and pull together those pieces of information needed to bring this to fruition. So just looking at the most recent results from the fourth quarter, this chart tracks revenue growth, profitability, and also the amount of revenue. Now, we anticipate this remaining very much the same going forward. There's several companies that had recent acquisitions that helped that push up their revenue growth relative to their revenue size. But you've also have what we're hoping to demonstrate too is that the India players are well positioned for increased application development and maintenance because they're going to be taking those legacy systems and making them more useful as far as being able to access different data sources, legacy programs, and do it in a cost-efficient way. So as far as with providers and payers looking to cut costs, there's going to be additional demand, and there's going to be some more work flowing to the India players. Saying that, we're also looking at the pure plays, your Cerner, your McKesson, and companies like NextGen, that their IT services are more focused particularly on their systems and getting those going. We see that they're going to remain much like that. And I think there is going to be some communication across the companies, but in most cases, these companies will be focusing continually on just using and implementing their own software systems. So the overriding trend is we're going to see a lot more of the general players and the India players moving into the space and benefiting from this push into interoperability. Now, what's driving this is the overarching movement to coordinated care. And in the U.S., we're looking at accountable care organizations as the centerpiece to make this kind of transition happen. What we're seeing is that there's any number of small offices, you have physician offices, hospitals, that may have disparate record systems that are going to need to have that level of interoperability and smooth transition to ensure that care is picked up and there's a handoff, and not just within the healthcare community, because accountable care organizations have that more inclusive feature where you're including social welfare systems, stakeholders in an individual's care, family members, government agencies that are looking to improve overall patient health and population health. So there's a lot more moving pieces, and making sure that you have that system being able to, with the standardized fields, but also being able to draw that unstructured data into those records is going to be a bigger and bigger piece. So just to reiterate, and I feel like I'm hammering this, but it's the generalists in the IT services area that are really going to see additional traction, being able to tie these systems together and create a systems integration piece that's going to work. A really good example of that we saw that came out in the fourth quarter was Cerner's win with the NBA. And this is a really interesting case where they're going to be actually creating a cloud-based EHR system, and it's caters to the highly mobile workforce that you had in the NBA, where, if a player gets an injury during an away game, the people that will be administering the care will be able to access that record and have that system interoperate with their own system to provide the top-level care that's needed. And the NBA doctors will always have that high level of access to individual patient records to make sure that they are giving that improved outcome level of care. We anticipate we're going to see more of this, and we also feel that Cerner is going to be able to bring lessons learned back into the Commonwealth Health Alliance and help it gain additional traction. And we anticipate more people joining that alliance as a result. So turning to the next piece, and with the highly mobile workforce, and the mobility of patient records that we're seeing with interoperability, is the greater level of mobility and how that's playing a larger role in everybody's life, and especially into healthcare, and how that's affecting how it's being delivered. One of the big things another big thing during the Health Information Management Systems Society meeting this past year was the level of iPads and tablets and other iPhones, people that are delivering healthcare using these devices. The other piece was how meaningful use is really incenting individual providers to have that mobile access to information. And underlying this whole piece is that you're having the general transmission or transition of healthcare from a patient-oriented to more of a consumer-oriented market, where actual patients are consumers of healthcare, and they're actively going to be measuring different outcomes, what different providers can do, what different payers can do, how they all interact, and they're going to be using their phone or a mobile device as a point of access, and their main point of access. Coupled with that, and the increased uptake in the smartphone market, is the increased level of communication that providers, payers, and life science companies will have with individual patients. Applications for fitness are, fast becoming the norm. There's programs like GymPact and RunKeeper, Map My Run, which, from an individual basis, you're capturing that healthcare or that fitness information. And similar applications are being used, throughout the marketplace, and for the care of chronic conditions, where diabetes, asthma, you can register, you can track your progress with these diseases and how that's going up. In turn, you have the ability for caregivers or physicians to broadcast information back out to their patient pool. If there's an exceptionally high pollen count, their analogist office can advise their clients to be aware and take the necessary steps. And in effect, you're improving the overall level of wellness in the place. And this is, for the accountable care organization, this is, a critical piece, and it's a valuable tool to raise that overall level of wellness in a population as well as in your patient set. And we anticipate this is going to continue with, companies like Jawbone, that they recently bought Body Media, a company that, wearable technology where you're actually tracking, blood pressure, pulse, anything like that, and it can be, transferred to your phone and then written to your electronic health record back at your primary care physician. And this is just going to become more and more the norm. The amount of information that's going to be generated is going to just continue to expand, as we've seen, and it will just drive that need for greater analytics and big data solutions, as well as, storage for this mounting wave of information that's coming in. One of the things that we're looking at is the uptake of this, and I think what we're seeing right now is the end user is just becoming familiar with using a smartphone for the maintenance of their own health, but as it continues to shift to the consumer base of healthcare use and how patients view healthcare, I think we're going to see, an increasing, and the steepness of the curve is going to increase greatly over the next couple of years. Now, those vendors that have been, making that steady investment will have to, accommodate the increased demand, but we anticipate that this is going to be, reach a point of inflection where it's going to just fully necessitate them to up their own investment to have the tools necessary. And this is going to be at the provider level, it's going to be at the payer level, it's going to be at life sciences, and it's going to be at the government level, because they will all need this regular access and, real-time access to healthcare data going forward. On slide 13, we're looking at, TBR did an assessment of the various providers that we track in the Health IT Services benchmark based on their mobility solutions. And what we found is that the generalists in the IT services and the government players have the most developed or mature portfolios of mobility access, and we anticipate that this is going to give them a bit of an edge as traction moves forward. However, that's the pure plays. There's McKesson, who's recently just announced 2 new pieces of mobility healthcare solution that they've rolled out, and we also anticipate companies like Cognizant that have application testing for mobility solutions. We'll see more of this as more applications specific to healthcare are being rolled out by providers and payers. So tying that together, we're seeing interoperability, mobility, and then that just comes back to the developments in 4Q that affected for regulatory. And in this instance, what we saw was finally, after an election year where the Affordable Care Act was in question, you had the Supreme Court decision in the summer that affirmed that it would be, and then you had the uncertainty that flowed around what was the outcome of the 2012 election. So the fourth quarter was finally the time that providers, state governments were able to know what their environment was going to be for the next several years and then take the action that they had planned on. With the Affordable Care Act firmly in place, Health IT service providers were able to actively go out to state governments for the implementation of the regular or mandated health insurance exchanges. And this is, just a starting point for many of them. Also, you have companies like HP Services and Xerox Services that have those well-developed relationships with state-level governments for the Medicaid system, able to leverage that and push forward. So one company that jumped out was CGI, which contracted with 6 states to establish those health insurance exchanges. And this is tied in with that, as I said earlier, the Hewlett-Packard service, the Xerox services, you had them with their CMS background. With the Medicaid expansion, they're going to be seeing increased health IT services revenue going forward. Another piece is with the health insurance exchange was General Dynamics Vangent landed a significant contract to actually do the call center work for that. And I think that kind of work is going to be, with business process outsourcing, is going to be another piece that governments, as well as payers and providers, to adhere with the regulations set forth in the Affordable Care Act, are going to need to expand their use of business process outsourcing services. So all told, circling back to our major themes, interoperability, mobility, and regulatory were the main themes that occurred throughout 4Q12 and continued into 1Q12, or 1Q13, excuse me. And we anticipate, they will continue throughout the year as we move forward. That said, we're also expanding our coverage, and we're going to continue to follow mobility more closely in our next quarter's topics. We're also going to use or take a closer look at the amount of data that's being generated and how clinical predictive analytics is coming into play at the actual delivery of care for more providers. And finally, with the sheer amount of information that's being generated, how health IT service providers are addressing the storage and big data analytical needs of their clients. And with that, I'd like to open it up for questions.
Great. Thanks, Joe. We've had a couple questions come through so far. The first question we have, what single vendor or group of vendors do you think is best positioned with regards to the storage of health IT workers globally?
Well, the continued shortage of these workers and being able to secure talent, I think, is going to your top level companies, the ones with the marquee names, will definitely be well positioned, and I think that they're going to be able to have an advantage as far as recruiting and retaining that health IT talent. That being said, I think that there's a push across the board to train up more workers. The demand continues to grow, especially with the regulatory piece. ICD-10 is coming fast for many providers. Payers are expanding their need to be able to have that access to data. Interoperability, again, is becoming a bigger and bigger piece. And I think so you're going to see your top-level providers coming into play there. Your Indo-centric players, they're very adept at taking expertise and then redistributing it out to a workforce. So I think in those two instances, you're going to see them be best positioned in the near term. Now, that being said, I think there is going to be greater and greater opportunity because healthcare providers are going to be leaning more and more on their health IT service providers going forward in the next year or so.
Okay. Again, I encourage anyone who has questions to send through now. The next question we have is, will the shift to greater interoperability bring about increased consolidation in the healthcare IT services marketplace?
I think that it does, and I'll share my reasoning. Is that what is going on is that you're going to have, although they still want, with standardization of information fields, I think there has been an underlying current of providers that have been dissatisfied with their electronic health record systems. And what we're going to see with this movement to standardization is that there will be greater ability to move between these electronic health record systems. And with that, you're going to have the larger players absorbing smaller players as their customer lists either contract or as competition becomes more fierce between them. They're going to need to have that additional technology and reach into markets that they may not have penetrated as much. So I think from a strategic standpoint, as we get closer to standardization of information, there will be increased consolidation.
Okay. We have another question that came through. Are there other competitors not covered in the study that we should keep an eye out for?
Well, I think that, yes, certainly. I mean, Epic is the one that everyone's turning to and as far as being a central player in the market and what they're doing but because they're so focused on their own packages, I think that it's a little bit less of a threat to your more general providers in the health IT services space. But I think that the government players that we don't track, say Northrop Grumman and Lockheed Martin, are two examples of companies that have very well-developed systems integration practices and are actively translating those skills into health IT services and being able to reach out and expand their own market share in health IT services.
Thanks. Doesn't look like we have any other questions that have come through, but we still have a couple of minutes. So I want to thank you, Joe, for your time, and thanks everyone for sending through your questions. As promised, here's all the social media links. You can follow Joe on Twitter as well as TBR. And you can also go to our SlideShare and YouTube pages for more information and content that we're putting out into the marketplace. As you're leaving the webinar, please take out a moment. There's a short 3-question survey. How good was the presenter? How good was the content? And if there's any other feedback that you can provide for us. We'll be using this feedback to improve our presentations from quarter to quarter, so we appreciate any feedback that you do give us. I'm going to leave the chat function open for another few minutes in case anyone has any last-minute questions or like to set up conversations with Joe. And if we don't hear from you today, we look forward to speaking with you guys all again next quarter. Have a great afternoon, everyone.